All right, so the very first thing I'm gonna do is check physician's orders, which says to do the intensive spirometer with a patient who just had a abdominal surgery. So I am going to grab my device. It's charted, her height and her age is charted, so I'm gonna figure out using this chart what her predicted value is, and it's 2,700, so I'm gonna just keep that in my head. All right, knock, knock, knock. Hi, I'm Katie.
Hey.
Hey, I'm with Respiratory. I'm here to kind of do some assessment and also show you how to use this device, okay? Before we get started, can I get your name and your date of birth?
Kristen Anderson, July 1591.
Perfect, thank you, Kristen. Now, before we get to this device, I'm just gonna do vitals, so SpO2, respiratory, heart rate, blood pressure, and I'm gonna check her breath sounds. Awesome. All right, so thanks for letting me do that. Now I'm gonna show you how to use this device, okay? Have you ever used this before?
No.
Okay, so this is a breathing exercise. I know that you just got done with some surgery, which is why you've been laying in bed, and it's good to rest and recover, and this is gonna help you open up your lungs, okay?
Cool.
So really, it's just gonna help you recover at a quicker rate and get back home to where you wanna be, okay? All right, so I'm just gonna guide you through it. This is the mouthpiece. This is your targeted number, which is 2,700, and you'll see a white float down here, and when you inhale, it kind of gives you a visual cue of how much air you can inhale into your lungs, okay? So this is gonna rise up as you inhale, and you want it to reach this yellow marker, okay?
Okay.
Now on this side, this is shows how quickly you're inhaling, and for this breathing practice, it's best to inhale really slow. So you kind of want to keep it near best or better. So do you see how best is at the very bottom? That's just meaning you just want to inhale as slowly as possible, okay? And then another thing is you're going to inhale. Once you've inhaled as much as you can, and it's going to be hard to reach here, so just do your best. But once you inhale, you want to hold your breath for as long as you can. So I would say about 3 seconds, okay?
Okay.
All right, so let's go ahead and try it out. There's a little handle for you to make it a little bit easier. So you're going to seal your lips around the mouthpiece, and you're going to inhale through your mouth as slow and as deep as possible. So go ahead and exhale normal, and then inhale. There you go, you're doing it. Nice job. Wow, I see it going real nice job. And then hold your breath. 3, 2, 1. Well done. Okay, that was really good. You reached your goal, so I might just have to inch this up a little bit more. Just kidding. Okay, so that was really good. You did a great breath hold at the end. Thank you for exhaling before and then you inhale. That's how you're supposed to carry out this device. You want to do this 10 breaths every hour you are awake, okay?
Got it.
So every time you do it, you know, I can come in and I can mark it on your whiteboard, and we're going to just try to fill up this chart as we go, okay? So 10 breaths an hour, and can you give me a big cough? Great, okay. So this is really important to do because it reopens up your lungs, and it makes it so that your air can reach even to the lowest parts of your lungs, and that's really important, okay? And then I'm going to take post-assessment, so vitals and breath sounds once more. I'm just going to leave this somewhere you can reach it.
Cool.
Let's just say this is there. All right, do you have any questions?
I don't think so.
Okay, thank you so much. I'll see you in a few.
Sounds
And yes, thank you.
Thanks.
So I'm going to head out. I'm going to hand hygiene. I'm going to take my gloves off, wash my hands, chart pre-post assessment, so vitals and breath sounds pre and post, and then I'm going to record that patient predicted value was blah blah blah, and she reached blah blah blah. Patient did 10 breaths as I was in the room, and respiratory therapist will follow as indicated, and I'm done.